Welcome, everybody. Really great to have you with us. I'm Meg Davis, and I'm here with Tara Imalingat and colleagues. We're here to talk about strengthening gender equity and rights in national digital health strategies in Southeast Asia, and really excited for today's conversation. So thanks very much for joining and being with us today. Um, so on the next slide, we'll see um, the translation feature. So we are very sorry. We thought, and we were informed, in fact, that there would be Vietnamese captions for today's session. Unfortunately, we do not have Vietnamese. We're not able to turn it on. We don't see where it is. So, but here is what you can do if you want other languages in translation. So you just need to go to More at the top of the screen, the three dots. And when you click on that, you can select Language and Speech and choose the language you wish to translate into. So please go ahead and do that if you want another language. And again, very sorry about the Vietnamese interpretation. We were really hoping to have that today. So thanks. Let's move on to the next slide. So as I mentioned, this is strengthening gender equity and rights in national digital health strategies in Southeast Asia. This is the second in our three-part series. The first in our series was focusing on countries in the African region. This one, Southeast Asia and a little bit of Western Pacific. And then the next one in March will focus on the Eastern Mediterranean, or the MENA, Middle East and North Africa region. And in each of these conversations, we're bringing together diverse experts, governments, UN partners, civil society, community, and youth leaders to think about what it means to address gender equity and rights in digital health strategies and policies at the national level. And then, of course, for the World Health Organization, there's a new digital health strategy that will be developed in the next couple years. So it's a great moment to think about what it means across countries and at the global level. My name is Meg Davis. I'm a professor of digital health and human rights at the Center for Interdisciplinary Methodologies at University of Warwick. And we have some wonderful speakers who we'll introduce as we go along today. The Digital Health and Rights Project on the next slide is, oh, that's me. All right, next one, thanks. The Digital Health and Rights Project is a consortium of universities, including University of Warwick here in the United Kingdom and Universidad de los Andes in Colombia, civil society groups, including KALIN in Kenya, and networks of people living with HIV in Vietnam and Ghana, as well as the global network of people living with HIV, global health advocacy groups, Stop AIDS, Youth Leadership Group, Restless Development, Fundación Charisma, and Privacy International, or human rights groups in our consortium. And we all work collaboratively in 4 countries in particular, using transnational participatory action research, where we co-design the research with the study participants to understand the realities of health in the digital age. Whoops, I think we're seeing some of your screen there, Javier. Some of you could close that, thanks. Great, so in the next slide, as you can see, we have a number of publications that are available on our website, digitalhealthandrights.com, including most recently, Paying the Cost of Connection, which is our big report with over 300 young adults in Colombia, Ghana, Kenya, and Vietnam. So really encourage you to check that out and other research and publications that we have. We also, on the next slide, you can see the Digital Empowerment Hub, which is on our website. And we have over 200 tools, videos, courses, workshop guides on human rights and digital governance. And that's to train yourselves, others, people you know. So please check out the hub. Really useful free resource. And all of this is to help us to think. On the next slide, you can see about the global strategies and policies and national strategies and policies on digital health and how they can really place marginalized groups, young people, at the center of the conversation of governance of digital health for the future. And this is really important, growing recognition of this at the World Health Organization, as we saw in the Director General, Dr. Tedros's recent report on the need to address gender, human rights, and equity across these different policies. And he really emphasized this in the report, and we really appreciated that because we really need this kind of conversation to be opened up so we think across different settings about what needs to be done. We're also very excited to share on the next slide that we've been working with the Global Fund to fight AIDS, TB, and malaria to think about how to address digital rights, data protection in health programs. And so in the new grant cycle, GC8, the Global Fund will now invest in funding for digital rights, data protection, advocacy, know your rights training for communities, and digital platforms to counter misinformation. So we really encourage those who are thinking about and engaging with the Global Fund requests in different countries to see if this is a fit for your specific needs and to request some funding from the Global Fund to support this area of work. And through that kind of collaboration, we also can, through the Global Fund, really learn across different settings what works to strengthen gender equity and rights in digital health and to ensure that all of our rights are protected. So it's a great platform for this kind of work to develop, and really kudos to the Global Fund and everyone who's engaged with the Global Fund to address these issues in the future. So for today, next slide, we're going to just quick overview. We're going to hear some opening remarks from Ramla Khalidi. Sorry, Ramla, mangling your name. Ramla Khalidi from the UN Development Program is joining us, and she's going to give us some opening remarks and some insights into governance of digital health in East and Southeast Asia. And after that, Tara, my colleague from the University of Warwick, will present a very newly published checklist on gender equity and rights in digital health strategies. And then we'll go to our panel discussion. And finally, we will open up to discussion with all of you and really look forward to the conversation. So I see Ramla is with us, and while she's sorting out how to be able to unmute and turn on her camera, maybe might need to be promoted in some way by our fearless host. So Ramla is the resident representative for UNDP in Vietnam since 2022, and she really has impressive and extensive expertise and background in development and in policy research. So we're very excited to have her with us today. And there she is. So Ramla, thanks so much for joining us, and the floor is yours.
Thank you so much, Meg. It's a pleasure to join you and to be here on this webinar on this important topic. So thank you very much for inviting UNDP to join this important conversation. So I want to use the short amount of time that I have to share a few reflections from Vietnam that draw on UNDP's own experience in supporting digital health and health systems reform, and maybe to offer some practical lessons that hopefully will resonate across the colleagues from the region. So first of all, for those who maybe don't know or are not very familiar with the Vietnam context, let me share some overarching developments here in the country. So over the past year, Vietnam has been going through a series of reforms, of governance reforms, and has adopted a number of party resolutions. And many of these have been aiming at accelerating development and improving people's livelihoods and their well-being. And if you don't know, party resolutions are really strategic guiding frameworks that provide the overarching direction for the government in the coming time. One of these resolutions that's particularly important for us and for our conversation today is resolution number 72. And that focuses on breakthrough solutions for healthcare with a very strong emphasis on digital transformation. The resolution explicitly highlights gender equality as a core principle, alongside, of course, universal access, fairness, attention to special marginalized groups and vulnerable groups, including children, people living in poverty, and those receiving social assistance. And I think for those of us working in development, the resolution is very welcome, and these directions are very much welcome. The resolution also has an accompanying action plan that goes even further. It sets out directions on health access, on equity, including a new policy on free healthcare for priority groups. And it frames healthcare as part of building a happy and prosperous society, and that very much embedded within a continuation of Ho Chi Minh's legacy. But when we look a little bit more closely at implementation, I think a familiar challenge emerges. So while gender equality is clearly stated as a principle in the resolution and in the action plan itself, doesn't really translate this into specific strategies that respond to the different needs of men and women. Similarly, I think gender is not explicitly addressed in the National Health Digitization Strategy to 2030. So Vietnam has a national digital strategy on health, but again, that one is not as explicit in terms of gender and gender equality. So that disconnect between strong principles on the one hand and concrete action on the other is obviously not unique to Vietnam, and I'm very much looking forward to hearing from others what their experience is, because I think it's something that we see in many countries in Asia and the Pacific, particularly when it comes to digital health strategies. And I think that that's been very much confirmed by the studies that the University of Warwick has done. And yet, of course, as you know, and I think most of you will agree, gender and equity matter very deeply for health outcomes. They matter when the language barrier or the cultural norms mean that people have limited access because of poor infrastructure to maternal health or family planning services. In Vietnam, ethnic minority groups live in particularly remote areas, so those kinds of barriers really matter. They matter because for sexual and reproductive health and rights. They matter in a rapidly aging society when women make up about 6 out of every 10 people over the age of 65. They matter when we look at the health risks. Smoking, for example, in Vietnam, and binge drinking are overwhelmingly male behaviors. And they also matter within the health workforce itself, where women account for about 2/3 of Vietnam's health workers, but only 28% of doctors and just 17% of the actual specialists. And of course, they matter inside households in terms of the burden of care, who carries the responsibility for managing treatment and caring for family members. So fast forward, and we can see where digital health has then enormous potential to transform this picture. Across Vietnam and within the wider region, we can see that digitization can bring health services closer to people. It can reduce costs. It can ease pressure on health workers. Obviously, digital health records can reduce the need to repeat tests, and it can improve the continuity of care when patients move between facilities. And this is, for us here in Vietnam, especially important for migrant workers or for seasonal workers who may be moving between provinces. And of course, online platforms can give access to information in a confidential manner, and that's particularly important for young people. But of course, digital health also brings new risks. Without the good governance infrastructure, it can undermine the privacy and trust. And when digital divides persist, it can actually reinforce some of the existing gender and equity gaps, and it can also perpetuate some of the biases and therefore exclude groups such as women or ethnic minorities, migrants, as we just said, low-income households, from the kind of digital services that are being offered. And that's where it's so important that design choices are made in a deliberate manner when we're talking about digitization in healthcare. So I want to briefly share one practical example from UNDP's work in Vietnam, what we call our Doctor for Everyone telehealth system. This initiative operates in 14 provinces. It's designed to strengthen access to quality healthcare, primarily for those people who live in remote regions, in mountainous areas, vulnerable communities, including ethnic minority populations. I want to just acknowledge that the lead expert at UNDP and our project manager, Dr. Ha, is also joining us today. So specific questions on that initiative, of course, Dr. Ha is also available to support in answering them. So the Doctor for Everyone was initially launched during COVID. The platform allows community members to connect directly with the health facilities. It also allows the frontline workers in some of these remote locations to consult with specialist doctors in the province to be able to access expertise and support more effectively and more efficiently. What we've seen is this system has been very effective in recent months when there were severe flooding and landslides and remote areas got cut off. That kind of system became critically important in order to provide the necessary care. For our conversation today, I think it's important to talk about how we built in gender consideration into the program from the very start. So women's participation was actively promoted in both training and capacity building activities, so that women are targeted both as trainers and as trainees. All of the indicators in our project are disaggregated by sex, and that allows us to quickly monitor the participation of female beneficiaries and be able to identify when any disparities emerge. If we see any indicators that note that we need to pay attention to, then we can easily follow up and adjust implementation to make sure that women are fully using the telehealth services. So as a result, women now make up about 55% of the training participants and around half of all of the users of the Doctor for Everyone telehealth application. This year, 2026, we plan to expand the system to support the management of NCDs such as hypertension and diabetes, and we hope to cover the full patient journey from screening to consultation and to making sure that the patient is adhering to treatment, again, with a strong focus on equity and inclusion. And of course, we're also applying gender and rights lenses across newer areas of our growing portfolio of digital health initiatives, including on AI governance, access to quality medical products, the regulation of software and AI within medical devices, and also corruption risk reduction in the health system. So just in sum up, I think what has our experience taught us and what may it suggest for others? First, I think gender equity and rights cannot sit only at the level of principles. They need to be operationalized. They need to be built into the indicators, into the budgets, into the data systems, and of course, into the feedback loops of the M&E systems that we have. The second is that digital health strategies must be designed with users, especially women, youth, persons with disabilities, and other marginalized community. And it needs to be designed with them, not just for them. The third key lesson takeaway that we have is that trust is foundational. And that means that privacy, safety, accountability are not optional. They determine whether people will actually use the digital health tools, whether they trust them, and must be factored in from the very beginning. And finally, I think perhaps one of the most important is that digital health should never replace offline access entirely. We understand very well that equity also means ensuring that no one is locked out of care because of lack of connectivity, because they don't have a device, or simply they don't have the digital skills. So digital health is not an entire replacement for face-to-face access to healthcare. So this is a critical moment for the Asia Pacific region. We know that many Southeast Asian countries are revising or developing their own national digital health strategies right now. And that, I think, creates a real opportunity. An opportunity to make sure that we can embed gender equality, that we can embed human rights and inclusion before the systems reach scale and it becomes much harder to make any kind of fundamental and design stage changes to them. So from our perspective and from Vietnam's experience, we know that this is possible. It requires intention, it requires listening carefully, it requires time and partnership and trust between governments, the UN agencies, the development partners, academia, civil society, and of course the communities themselves. So I think if we get this right, digital health can really become a powerful driver of universal health coverage. And I think it can really become a tool that helps to bridge gaps rather than widen them. So I hope that this small sharing of experience and lessons from our small initiative in Vietnam is helpful to you in terms of distilling some lessons for the discussion. So thank you again for inviting UNDP to be part of this. Over to you, Meg.
Thank you so much, Ramla. That was really a wonderful intervention, both kind of combining the principles and strategic view, as well as the very rich details from your insights into policy and practice in Vietnam. So thank you so much for sharing that. I wish we had more time to dive into it because I would love to hear more, and I'm sure our other listeners would love to hear more as well. So please stay if you can, though we understand you have other responsibilities and you may have to run. And wonderful also to know that Dr. Ha is with us today. So yeah, would definitely welcome Dr. Ha to share insights also. Before I hand over to Tara to talk about the checklist, I do want to note, as noted in the chat, we had planned to have Vietnamese captions. We really deeply regret that that's not working. We don't understand why. We've tried to solve it. So my colleague Javier is suggesting that you turn on either Google Translate or a similar app to all of our Vietnamese participants if you want to follow along. With that, I will hand over to Tara Imalingat, who's an advocacy and impact coordinator for the Digital Health and Rights Project at University of Warwick. Thanks.
All right, Javier, kindly share the slides once again. Thank you. Next slide, please. Thank you, Meg. So I'll quickly take us through the checklist so you can find out what it's about and what you can expect to see. So recognizing the gaps in the 20 strategies we reviewed and the need for tools that can really support more inclusive and equitable strategies, we drew on our review and other evidence to draft a checklist, basically on gender, equity, and rights inclusion in digital health strategies. So we decided to structure the checklist around 6 key thematic areas that we found commonly form the foundation of national digital health strategies. Under each of these sections, we have included a set of guiding questions, which are designed to help facilitate discussions and ensure that strategies are really grounded in human rights and are people-centered. The first area focuses on the methodology used to develop the strategy. It aims to ensure that the strategy is informed by the expertise, by the expertise of, a diverse range of stakeholders, including, government ministries, gender equality and human rights experts, and civil society. And also on the lived experiences of young people and other population groups, because I think that's very important. The next area focuses on the situational analysis and evidence generation, which aims to ensure that strategy developers are really thinking about the types of data and evidence needed to understand their context and address the different governance gaps that they identify. So, for example, evidence on the barriers in connectivity, finding out how different populations are using different platforms for health, including social media and chat AI apps, or whether they have, reviewed public research and data sources for sex and gender bias. So those are some of the questions you can expect to see. Our goal with this third section is to make sure that the core framework, so the very foundation of the strategy, really embeds rights, gender, and equity as core values and guiding principles. So under this section, we also wanted to ensure that strategies really align with international, regional, as well as national commitments to health equity and related human rights. So the fourth section really focuses on setting strategy objectives that include commitments to addressing digital health governance gaps and ensuring the inclusive and acceptable design of digital technologies. It also, of course, seeks to advance gender equality in the health workforce and also digital literacy among end users and healthcare workers. The implementation and digital public infrastructure section includes key questions that focus on funding and implementation strategies that, of course, ensure equitable access to digital technologies and also minimize harms, either by, fostering coordination between different ministries, preventing data breaches and cyber attacks, and also applying universal design and design justice to make sure that these innovations really work for everyone. Finally, we have just a few questions on M&E, so monitoring and evaluation, that really want to ensure that strategy developers and consultants use mechanisms that include stakeholder views and that can easily identify and respond to different gaps in gender equity and rights as they emerge over time. Next slide, please. So here we have just an example of some of the questions under the situational analysis and evidence generation section. As mentioned earlier, these questions really seek to ensure that the evidence gathered can be used to advance gender equity and rights, and that the right data is collected and compiled. So for example, do you have evidence on digital use, uptake, data that shows who has access to these technologies, who doesn't, and whether barriers are being considered and addressed. There's also a lot of research out there that's been developed by UN agencies, healthcare experts, human rights experts, NGOs, civil society. So we really think that those should be reviewed, and especially the ones that are specific to the different country contexts. Next slide, please. So these set of questions basically aim to, as mentioned earlier, embed gender equity and rights in these strategies, and really make sure that the vision and mission statements, as well as the principles, identify these issues as priority issues. So these are just a few suggestions, but we are hoping that these lists spark other ideas of national strategic information that, or expertise that may be needed for the specific country context. And yeah, of course, we welcome other ideas. So next slide, please. So the checklist also includes a list of reference materials that can be relied upon. For example, we have international human rights treaties, UN human rights treaty body reports. We also have UN normative guidance on human rights, gender, and digital technologies. So we have actually compiled an annotated list, which is available on the DHRP website. So you can find it in the checklist, but also as a separate resource in the DHRP website. We also have some regional and global strategies and reports that countries can use. Again, these are just suggestions, but more can be built as more guidance and reports and other evidence is developed. Next slide, please. So we are launching the checklist today. It is now live and available on the website. My colleague Javier will be sharing the link in the chat. So please keep an eye out for it there, or just check out the DHRP website. We also have a lot of amazing publications, as well as the Digital Empowerment Hub that Meg mentioned earlier. Next slide, please. So this slide essentially shows a list of member states with plans to develop their digital health strategies in 2026 or 2027. Within the Southeast Asia and Western Pacific regions. As you'll see, it's a very diverse list of countries. And we know a lot more countries are also revising their strategies soon. So this conversation remains timely, as Ramla had stated in her opening remarks. And we hope you find this information useful. If anyone in the audience can share more information on countries revising or developing their strategies, or can connect us directly with them, that would be very welcome, so we can share this checklist with them directly. And that is basically the end of my presentation. I hope you now have a better idea of what our checklist is about. I hope you find it useful. Please share it widely, and thank you so much for your time.
Thank you, Tara, for sharing that and for all the work you've done with WHO and other partners to develop the checklist, and hope it will be useful and really welcome feedback from colleagues who try it out. So with that, I'd like to invite our panelists to unmute and turn on their screens. So very delighted to be joined today by Kind Soo Win, who's the Strategic Development Director at ILGA Asia. And so Kind actually worked with on and off in different roles over the years and is currently a member of our digital rights advisory team who are advising our council on kind of how we apply human rights in considering digital health cases that come up in the course of our research. Is Kind with us? There you are. Great. Okay. I know there's been some issues with the camera, so if you can turn it on, great. But if not, we're very happy to have you with us. Are you able to hear me? I think maybe needs some help to unmute and open her camera. So while that's getting sorted out, let me also introduce Nguyen An Tu, who I hope I'm pronouncing that correctly. And Tu has been with us in the Digital Health and Rights Project for the past 2.5 years as part of the Vietnam network of people living with HIV. Tu has been active in HIV prevention and control since 2019, focusing on young people affected by HIV in Vietnam, and he's the youth program coordinator, so he really has been a key person in our conversations with young people in our project. So welcome, Tu. It's great to have you with us.
Good morning, everyone. Good afternoon, good evening, everyone. So today, I'm Tu. I'm from Vietnam Network of People Living with HIV VNP+, and I'm a member of DHIP study process. And today, I'm so very happy to be here, and I would like to quick share some context and a few findings of the study in Vietnam beyond the state of the gender equality. And so the challenge related to gender equality in Vietnam, human rights, and social inclusion in healthcare in Vietnam. And the first, we see the gender digital divide still exists. Women, especially transgender individuals, rural residents, and the ethnic minorities have more difficult accessing device and the internet than many people. And so according to UNICEF 2023, Vietnam has achieved overall gender equality in digital skill. But DHIP research shows that women and transgender people talk much more about this barrier. And the challenge second, the technology facilitates gender beyond the violence is become increasing common on the servers in Vietnam. It's creating a major obstacle to safe access to healthcare. It includes such as online stalking, cyberbullying, and sexual harassment, and non-consensual sharing of the intimate image. So threats of violence or the misuse of the personal data, and all of which are committed or amplified through technology. And I think the Digital Human Rights Project GHIB study 2024 and 2025. So that's women, including transgender women, experience barriers much more frequently than men, and they are more likely to face coordinate group building and stalking and hate speech related to gender identity, and CX not only cause physical and psychological harm, but also make individual afraid to use health apps and say reproductive health information or seek online counseling. And the third, I think, we think stigma combined with surveillance is a top barrier. And stigma related to HIV, sexual orientation, and gender identity combined with surveillance from family and community and government, and I think private company, and it created fear of the discriminations and people living with HIV and LGBT LGBT plus individual, especially transgender people, are most heavily affected with the woman and transgender individual bearing the greatest burden. And the GHIP 2025 reports and UNS emphasize that this trust and the access to service, and I think urgent action is needed to data protect and anti-stigma efforts, and is own from Vietnam, challenge from Vietnam. Thank you.
Thank you, Tu. So really appreciate what you did, because Tu was planning to speak in Vietnamese and had to use the captions for translation. And so on the spur of the moment had to do it in English. So that's very kind of you. And I just want to note also our colleague Trang Pham, who is also from the Vietnam Network of People Living with HIV. And she's also with us in case we need a little bit of extra support for communication. But thank you, Tu, and thank you for highlighting the gender digital divide, the issues with inclusion of diverse groups and access, and the really serious issues of online abuse, which are really timely as we're discussing in many countries what to do about online harms, and really have shown in Vietnam that fear of stigma, surveillance, as you say, fear of harm, is a barrier to accessing digital health for many young people, especially in marginalized groups and for young women in their diversity. So thank you for sharing that. Kine, are you with us? Would you like to come in and maybe share some of your insights into some of the challenges we need to address in the region? Thank you.
Yes, I'm here. Thank you very much for giving me the floor. From my side, I want to highlight the key challenges that is facing by the LGBTIQ community in South Asia regions. In the previous speaker that they already mentioned that digital hub is not neutral. Without explicit attention to gender equality, human rights, and digital inclusion, digital health system risks replication structural inequalities, particularly for women, LGBTIQ people with disability, migrants, and those in restricted settings. So first, key challenges that our community been facing is criminalization, censorship, legal ambiguity online. Across South Asia, cybercrime, misinformation, morality, and the national security laws are routinely used to criminalize LGBTIQ expression online, even where same-sex relationships are not criminalized. Vague legal terms such as decency, public order, or national security enable contact takedowns, arrests, and intimidations, leading to widespread self-censorship among LGBTIQ users. So as an example, in Indonesia, queer people avoid searching or sharing health information online due to the risk of exposure and backlash. Digital health access constricted by the religious and moral policing. And similarly, in Malaysia, government blocks LGBTIQ and human rights website, which leads to the restricted access to the health information. It's a continuous online harassment. It's also amplified by the media and political actors. There is a fear of the criminalization, and then it's which discourage use of the digital mental health and the HIV resources. In Singapore, LGBTIQ contacts are regulated through age registration and contact control, so which limits the visibility of the sexual health and identity-related informations. In Philippines, even though there's like no specific criminalized law against the same-sex act, but there are ongoing online gender-based violence. LGBTIQ users face harassment when discussing about health, gender, and sexuality. So second challenges is technology facilitated gender-based violence. Majority of the LGBTIQ activists, especially trans women, queer youth, and those with intersecting identities, are disproportionately targeted by those in outing sexualized threats, smear campaigns, non-consensual surveillance, and spyware. There is an example like when the Thai gay couples, when they uploaded about their weddings photos, they face the waste of the homophobic abuse from the Indonesia Nazi. Mainstream media and politicians use discriminatory languages toward LGBTIQ communities and even blaming them for the natural disaster in Indonesia. The queer health and storytelling forums in Malaysia was postponed after online death threats and state condemnations. Similarly, like there is like a government being increasingly using the framing cybersecurity and disinformation threats to justify expand surveillance power, often with the weak oversight and no SOGI SEC. There is an example, it's reported by the Amnesty International. In Thailand, they use the where against women and LGBTIQ activists, which create the widespread fear that private digital communication, including health-related one, could be weaponized. So as a result, Thai LGBTI activists reported withdrawing from online spaces, including health and psychological support platforms, due to the sustained digital abuse and lack of effective remedies. This directly undermines trust in the digital health platforms, particularly among marginalized groups. The last one is digital queer divide. The current digital space is exclusive many of the marginalized community, including LGBTIQ. So when we say digital exclusion, it's not only about access to device or internet, it's also about the fear of exposure, which prevent the safe online participation, low digital literacy, and lack of secure tools, which undermine the protection. Algorithmic biases and platform moderation silence the queer contents. These factors combine to exclude LGBTIQ people from digital public life, service, and advocacy spaces. So these challenges show that digital inclusion is not only about connectivity, it is about power, protection, and participation.
Thank you very much, Kine. Really very, very concerning issues, and thank you especially for sharing some of the findings from that research and how fear of stigma, surveillance, and abuse really creates huge barriers for marginalized and diverse communities to access health information and services online, and especially the issues around misinformation, disinformation, really have emerged often in our research in Vietnam with partners in Vietnam, where we see, for instance, and I'm sure Tu is going to speak about this, but sometimes this kind of online abuse, spreading misinformation and targeting individuals for harm in order to generate clickbait and get more eyes on a website. So maybe with that, I'll turn back to share a bit about solutions and what are innovations and approaches that you see in Vietnam that are working to try to make digital health more inclusive. And maybe Tu, if you are comfortable to speak in Vietnamese, Trang has kindly offered to help to summarize your comments. Thank you so much.
Xin chào tất cả mọi người. Thì tôi sẽ nói tiếng Việt về những cái đổi mới sáng tạo tại Việt Nam trong cái công cuộc là hòa nhập y tế số dựa trên bối cảnh bình đẳng giới và y tế.
Trang, are you able to summarize for us? I think you're muted right now. Thanks.
Oh, yeah, sorry. Hi, I'm Trang from Vietnam Network of People Living with HIV, and I'm here to help to translation. So he will share about the local innovative solution to promote social inclusion. Yeah.
Đầu tiên thì tôi thấy rằng là có một cái nền tảng telehealth bác sĩ cho mọi người tới từ Bộ Y tế cùng với cả UNDP, thì nền tảng này là một cái nền tảng tư vấn từ xa, hỗ trợ các vùng sâu, vùng xa, vùng dân tộc thiểu số và người khuyết tật. Nền tảng này đã thu hút hàng trăm nghìn người dùng và đào tạo hàng nghìn nhân viên y tế tại các cơ sở y tế theo báo cáo của UNDP vào năm 2024.
Okay, so the Doctor for Everyone telehealth platform implemented by the Ministry of Health in partnership with UNDP provide remote the medical consultation and improve access for people in remote areas and ethnic minorities and person with disability. So the platform has reached like hundreds of thousands users and strengthened grassroots healthcare capacity through large scale training.
Tiếp theo là ứng dụng về thông tin sức khỏe sinh sản và phòng chống bạo lực giới bởi UNFPA và các cộng đồng tại Việt Nam. Thì nền tảng này giúp phụ nữ và thanh niên tiếp cận được tới các kiến thức an toàn theo cái báo cáo của UNFPA năm 2023 và năm 2024.
Yeah, in addition, the digital applications on reproductive health and gender-based violence prevention support by UNFPA and community partners enable women and young people to access safe, reliable information and support from 24 to 25. 2024, 2025. Yeah.
Và một cái sáng kiến mà tôi thấy rằng là nhóm cố vấn cộng đồng tại Việt Nam, VKET, thì lãnh đạo do cái cộng đồng dẫn dắt, bao gồm các cộng đồng như cộng đồng người chuyển giới, cộng đồng người nam quan hệ tình dục đồng giới, cộng đồng người phụ nữ bán dâm, người sống chung với HIV, thì cộng đồng đã can thiệp vào thì nhóm đã can thiệp vào những cái thông tin sai lệch trên mạng xã hội và hỗ trợ tư vấn, chia sẻ thông tin tới các thành viên trong cộng đồng và các thành viên trẻ. Và VKET còn hỗ trợ các hoạt động về nghiên cứu và vận động chính sách tại Việt Nam.
Notably, the Vietnam Community Advisory Team VCAT, including groups of PLHIV, LGBTQI+, transgender, MSM, and sex work group as well, led by community leader, plays critical roles in addressing misinformation, countering online stigma, and providing counseling and peer-based informations. They also contribute to focus group discussion and policy advocacy, ensuring that the community voices inform digital health and human rights policies. Yeah.
Thì trên đây là một số cái sáng kiến ở Việt Nam, và còn rất nhiều sáng kiến khác như là đăng ký khám chữa bệnh từ xa hay tư vấn khám chữa bệnh từ xa thì cũng được thực hiện khá là mạnh. Và đấy là tất cả những gì tôi muốn chia sẻ.
Yeah, so here is some innovation solution I would like to share. Beside that, there are a lot of different alternatives like digital healthcare consulting as well. Yeah, so thank you.
Thank you so much, too, for those insights and for sharing those inspiring examples. And big thank you to Trang for the spontaneous interpretation. So thank you. That was really helpful. And I think, you know, for us, having worked as the Digital Health and Rights Project with VNP Plus and the Vietnam Community Advisory Team, we've seen how young people in the Vietnam Community Advisory Team have mobilized in different ways to support each other using digital platforms. So for instance, through Zalo, which is the Vietnamese equivalent of WhatsApp, the social chat group, there's platforms and groups where people help each other to access information and treatment and care, which was life-saving, I think, in many cases, especially during COVID-related lockdowns. And the Vietnam Community Advisory Team has engaged in online advocacy, as Tu was mentioning, in response to cases of abuse where someone was accused incorrectly, inaccurately of spreading HIV to sexual partners. And these accusations went viral, and the Vietnam Community Advisory Team really got online to try to stop the spread of this harmful allegation and to stop the misinformation, and liaised with the government and with different partners and the private sector to respond to these different issues. So I think we really see here how communities can really be at the center of developing innovative solutions using digital platforms to make health more inclusive online. Kine, would you like to share some examples also from ILGA's experience of local innovation that is working to promote inclusion? Thank you.
Yes, thank you, Matt. So in the region, LGBTIQ organizations are increasingly prioritizing digital security as a form of protection and care, including security communication practices, risk assessment before online campaigns, crisis response protocols for online attacks, community-based digital safety trainings, which is often like low cost and peer-led, have proven critical, especially for the under-resources groups. There is also approach like digital inclusions improves when the programs combine online tool with the online support, like ASMR, like SMS based outreach hotline models allow user to access the health information without creating a permanent digital footprints, which is critical in the restricted context. Also, there are like community-led trust-based digital health models, especially in the restricted environments. LGBTIQ organization use close, moderated online groups and encrypted messaging to share health information safely, especially around HIV, mental health, and gender-affirming care. So these spaces balance visibility with safety, especially for trans community, intersex, and the rural LGBTIQ communities. Um, Also, LGBTIQ groups are systematically documenting online abuse, censorship, and surveillance to challenge state denial, support international advocacy, build evidence for strategic litigations by using the UN mechanism and advocating through this, and storytelling and digital archiving are used as a counter narrative to moral panic and disinformation. Since this digital security is not the issue alone by the LGBT, there is also impacts to the other human rights groups. There is intersectionality with the other human rights groups are also happening. The affected initiated linkage LGBTIQ digital rights with feminist movement, youth and democracy movement, journalists and digital rights defenders. So these alliance strengthen collective protections and amplify political leverage. So these programs that works best when it's recognized the overlapping vulnerability, gender, age, and religions, disability, and legal status. For example, in southern Thailand, Malay Muslim LGBTI activists rely on the discrete community-based digital networks for psychosocial support due to the compounded stigma and surveillance. Yes, these are the few examples that is happening in the regions, which is community-led and prioritizing their safety.
That's amazing, Hein. Thank you for sharing those examples of kind of local community-led innovation. When we think about innovation in the digital age, we often think about the expensive, big technological models, but for really ensuring inclusion, I think these community-based and peer-led approaches are at the front lines of reaching the people who most need to be reached to address widespread and difficult to address health issues, and to really engage community leadership is absolutely essential to put them at the center of these discussions. Kine, I'm going to turn back to Tu in a moment, but I'm curious how you see, and sorry, this is off the cuff question, but how you see the funding cuts that have been happening recently with the US, the UK, Europe. Has that affected any of these kinds of community-led initiatives at this stage, or is it too early to say? Thank you.
If it is affecting, if I say frankly, yes, there are many groups, because many groups been they affecting their sustainability, because now many of the groups are in the survival mood, and also even the group that is relying on the small sub-granting or small grants, some of the groups are already disappearing. But a man LGBTIQ local group and also regional organization, we also discussing about to maintaining this kind of low cost programs, and also online training, especially we can continue the maintenance of the online training for the digital security and digital literacy. Also the parallel with the funding gap, but they are also the increasing a collaboration among the different community networks, including feminist networks and also the digital defenders network. These are also helpful to sustain the work that is local organization been doing. Yes, main effect is a existence of the especially small group emerging groups, and also yes, their sustainability and then continuation of their work in the local level.
Thanks so much for sharing those insights. Yeah, it's really appreciated, and it'll be really essential for those groups to survive into the future. So really appreciate the work Ilga is doing there. I'll turn back to Tu now for the last question before we open up for discussion, which is what are some of the steps that can be done to address ensuring gender equity and rights as part of national digital health strategies. Thank you. And Tu, maybe if you can summarize your comments, and maybe Trang, if you don't mind helping us again. Thank you.
Ok, ok. Về câu hỏi thứ ba này thì tôi nghĩ là các bước tích hợp về bình đẳng dựa trên cơ sở giới vào chiến lược y tế số quốc gia tại Việt Nam. Thì đầu tiên, tôi nghĩ rằng là thực hiện các phân tích giới và thu thập dữ liệu phân tích theo giới, độ tuổi, nhóm dân tộc. Thì tôi nghĩ đây là cái khuyến nghị cốt lõi của WHO.
Yeah, step to integrate gender equality and rights into the national digital health strategy. So I think first conduct gender analysis and collect disaggregate data by gender, age, and ethnic group. I think the core recommendation of WHO.
Tiếp theo tôi nghĩ rằng là một điều nữa là đảm bảo sự tham gia có ý nghĩa của phụ nữ, thanh niên và nhóm dễ bị tổn thương trong các cuộc họp lấy ý kiến, thông tin liên quan tới sức khỏe số.
Secondly, I think ensure meaningful participation of women, youth, and vulnerable groups in consultant meeting regarding to digital health.
Cuối cùng tôi nghĩ rằng là để giải quyết cái vấn đề bất bình đẳng giới thì nên có những cái đào tạo kỹ năng số, ưu tiên cho phụ nữ vùng sâu vùng xa và tập trung vào đào tạo AI, an ninh mạng và xử lý bắt nạt trực tuyến cho phụ nữ, thanh niên và nhóm dễ bị tổn thương. Thì điều này phù hợp với chiến lược bình đẳng giới quốc gia năm 2021-2030.
Thirdly, build digital skill and prioritize women in remote or rural areas. Focus on training on AI, online safety and handling online harassment for women, youth, and vulnerable groups. I think it's in line with national gender equality strategy 2021 to 2030. Thanks.
This all for me.
Great. Thank you so much, Tu and Trang, for those high-level comments about the importance of really including meaningful consultation and participation with diverse groups to ensure that strategies really have all the information and all of the objectives they need, as Ramla has said, to really operationalize some of these changes. Kind, any thoughts from your side about what should be done to address these things in strategies?
Yes. So from my side, what I want to add is legal and policy reform. Now, currently it's like there are criminalized law that is more against the LGBTQ is imposing this digital violence. So it is important that this to repeal or amend cybercrime, conduct regulation, and surveillance law that are vague, overbroad, or discriminatory, and explicitly recognize the SOGI-based discriminatory and violence online in the national law and policy. Also, the government should regulate the surveillance and protect the privacy by limiting the data sharing, requiring the judicial oversight, and prohibiting use of the health data for law enforcement or the morality policing in the region. And should be impose strict oversight, transparency, and judicial authorizations for the any digital surveillance. Also, to support the inclusive digital access, we should invest in the safe, affordable, and accessible connectivity, paired with the digital literacy program designed with LGBTIQ communities and other marginalized community, and promote institutionalized participation of the marginalized group. What do I mention? Like, so this all the women groups, LGBTIQ, disabled, people with disabilities, must involved in the every stage of the programming, system design, procurement, monitoring, evaluations, and also it's important like this community-led digital safety well-being being funded in the sustainable way. Another point I want to raise is like invest in the capacity building and the accountability, especially to train the health worker, policymaker, and tech partners on the digital equality, human rights, and technology facilitated gender-based violence risk, and especially hold the accountabilities of the tech companies. So should like demand like the platforms, their platforms to address the algorithmic biases, respond promptly to anti-LGBTIQ hates and harassments, and also ensure transparency and content moderation decisions.
Great. Thank you very much, Kind. Very comprehensive agenda, so very much appreciated to strengthen human rights and gender equality at national levels. So really a huge thank you to our panelists. I'm going to hand over back now to Tara, who will lead the Q&A and the discussion and really encourage everyone to participate, because this is really an opportunity for all of us to learn from the diverse experience and knowledge in this Zoom or Teams chat. So with that, over to you, Tara, and look forward to this conversation. Thank you.
Thank you, Meg, and thank you Tu and Kind for the amazing responses. A lot of really rich information has been shared, and I'm sure a lot of people will watch this recording a few times over, because what you shared is very, very important. I'm not seeing any questions in the chat for now. I do have one or two. So both of you have definitely mentioned a lot of community-led innovations, and how a lot of communities are coming together to counter harms and misinformation. I'm curious, are these different communities, so LGBTQI communities and communities of people living with HIV, are they being meaningfully included in the development of policies and digital health strategies? And if not, what approaches do you think can be used to ensure their active participation in policymaking and strategy development? Maybe we could start with Kind.
I would say it's like it depends on the national context. So many of the nation might have like a mechanism. For example, like in many South Asia countries have like mechanism for like a community participation, community feedback mechanism at the national level, and then there is like assigned representative from the community to be able to provide inputs in the national strategies or like an implementation process. But overall, maybe not all the country this mechanism in all countries this mechanism being efficient and meaningful, especially in the context that is like a state criminalized LGBTIQ, or the state criminalizing the people living with HIV and other marginalized group. And plus like there is a country that is ongoing conflict with the militarization or the and the authoritarianism is like definitely not sure this mechanism being like really legitimate and also meaningful. So I would say if yes, so it is very like a context specific on which country been be meaningful. But like what I learned from too is like in Vietnam, it's look like this. There's like a mechanism that is allow the marginalized community to participate. Maybe also I feel like this might be also the opportunity because among ASEAN country can share this lesson learned and how they can be more promote this meaningful participation from the community. But another opportunity for the community is like a UN mechanism. By using the UN mechanism, can raise like how the implementation the national level look like, and then how the government can take step forward to promote this, create the enabling environment for the community.
Yeah, absolutely. I think yes, I suppose it depends on national context, but yeah, I think there are ways to ensure the meaningful participation, and I think the key word is meaningful. Yeah, I think definitely taking into consideration the views and perspectives of different communities and having that be reflected in the different documents, strategies, and policies is very key. So yes, I hope more national governments really think about how to make their public participation, more meaningful, especially as we enter this digital age more and more. Tu, would you like to respond as well? What approaches can be used to ensure active participation of communities in strategy and policy making in digital health?
Hello, xin chào. Tôi nghĩ rằng để đảm bảo sự tham gia của người trẻ vào cái quá trình hoạch định chính sách và xây dựng chiến lược, thì tôi nghĩ rằng là trước tiên người trẻ cần phải tự nâng cao năng lực cho bản thân và tìm kiếm cơ hội nhiều hơn trong những cái cuộc họp, những cái hội thảo về hoạch định chính sách liên quan tới sức khỏe số hay là y tế số trước tiên.
Yeah, I think first of all, they need to improve their skill and building capacity, and also they should like find or seek the opportunity to participate in the consultation session to gather their opinions. Yeah.
Khi mà họ có đầy đủ thông tin, đầy đủ kỹ năng, đầy đủ kiến thức để có thể trao đổi hay là đưa cái thông tin của mình tới các nhà hoạch định hoặc tới các bên liên quan hay tới chính phủ, thì họ sẽ tự tin hơn và không cảm thấy rằng là mình bị yếu thế và bị thiếu tiếng nói.
And I think when they fully understand it, and also enough information and knowledge, they will be more confident and they don't feel left in behind.
Yeah, I completely agree. I think digital health and civic literacy need to be increased and enhanced so that participation can be meaningful. So I agree. I think I know both you and Kain have talked about enhancing digital literacy among different communities and how these different community-led initiatives are really spearheading this effort, which is amazing. But absolutely, I think having more courses and really embedding digital literacy, health literacy, and civic literacy into the different health initiatives, especially in the strategy development implementation and digital health policy implementation plans, I think is very, very important. I think one more question before we have to close. I hear a lot about trust. I think you both shared a lot about the fear of exposure and lack of security that these different communities feel when they are online, the different digital harms they're facing. And so I'm curious to hear from both of you, if you could just share one thing you think at least as a first next step, just one thing you think needs to be done to increase trust in these digital health governance frameworks among these different communities. Anyone can start, but maybe Kine, we can go with you first as well.
I think to increase the trust in this state-owned digital platform is like a, I would say like in some country there is already like a strategy that mentions that is the protections and the or banning or no usage of the information, but the actual when it is actually implemented using this like a cyberware to monitor the digital like activists, these things happening. For example, in Thailand, like for the LGBT acceptance is quite high, and but even in the kind of country there this kind of surveillance and monitoring happen, and then it's break the trust from the community. So it's, I would say, like banning of this kind of surveillance system, and also commitment from the governments to be like to remove this kind of cyber crime and content regulations, and as showing as a like a taking the action and showing their commitment and take accountability or promoting the rights of the LGBTIQ community and also other marginalized community.
Absolutely, thank you. Yes, I hear you. So less surveillance and more commitment from government in terms of better regulation and really amplifying the human rights of these communities across the health governance systems. What about you, Tu? Any insights to share on this?
And for me, I think I trust in digital platform can be changed by ensuring data privacy and security and transparent governance, user participation, and clear accountability mechanism.
Agreed. I think, yes, I think accountability, transparency and accountability is very, very important. And making sure that what the commitments government is making are actually being seen to be done, and that different groups can hold them accountable if it's, we're not seeing progress in these areas. So I think that's very important. Thank you. I think we now have to sort of wrap up, but thank you both so much.
Tara, there was one more question in the chat there.
Oh, okay.
Yeah, from Paul.
Okay, we've got a question from Paul. In the last year or so, there has been a significant change in the aid development donor landscape. Has this impacted in community digital health in Vietnam? Maybe Kine, you could respond to this question.
So my understanding, because like for us, is we work closely with our member organizations. So so both through our member, what we learn is like a as I mentioned earlier, is there is a funding gap happen, and then many of the organizations, they also have to change their like priorities, program priorities, or some of the event organizations, smaller organizations, they have to working on the volunteer basis, or the organization not existing anymore. It's happened in Vietnam, what I understand. So but to me, is what I know is like a not specifically on the community digital health, but mainly affected on the program like HIV or health related program being affected and impacted on the like accessibility of the ARD. This is what I know. but maybe to know explicitly about the community digital health aspect.
Would you like to share a little more on the community aspect?
May I?
Yeah, please go ahead,
May
Trang.
I? Yeah. I think from my perspective, over the past year, in the development aid landscape have pushed the donors to reduce traditional funding while prioritize digital platform like efficiency and accessibility. This investment in the community digital health in Vietnam, such as telehealth, digital data systems, capacity building, especially for underserved and remote populations. I think at the same time is that increase pressure on local actors to demonstrate impact, ensure data governance, and integrate community need into nationally led digital health strategies. So this is my perspective. Thanks.
Thank you so much, Trang. Paul, I hope your answer has been adequately answered. Your question has been adequately answered. I think I'll pass over to Meg so we can wrap up, but thank you all so much for your contributions.
Yes, thank you, Tara, for chairing that discussion, and then also huge thank you to Trang and to Kine. Maybe we could just have the slides back, please, Javier. That would be great. Thank you. So really appreciating everyone's participation despite some technical challenges. It's been really rich discussion and a lot of learning from Southeast Asia, Vietnam. So our last one of these will be on March 5th, right before International Women's Day. So please join us for what I'm sure will be a very interesting discussion about these issues in the Eastern Mediterranean context, or also known as the MENA region. So please do join us. You can sign up at the link below. And we will also be sharing the recording with everyone who registered, even if they weren't able to join us. So I think that is it from us. A big thank you to the team who supported this and to everyone at the Digital Health and Rights Project, and in particular, our improvised translator, Trang, who's a very good speaker in her own right. So thank you very much, everyone, and hope to see you in March. Bye-bye.
Thank you. Bye-bye.
Thank you.
Bye bye.
Thank you, guys. Bye.
Bye.